If your knee hurts every time you stand up from a chair, I want you to know something right away. That pain is not random, and it is not just a normal part of getting older. In fact, that moment when you rise is a revealing test for your knees. When pain shows up there, your body is trying to tell you something important. A lot of people notice it first when they get up. Whether it's the couch, the dinner table, or the car, there is a sharp ache, a stiff feeling, or a sense of giving out. Sometimes it fades after a few steps, and sometimes it lingers. Either way, it can be frustrating, confusing, and honestly a little scary. What most people do not realize is that standing up actually puts more stress on your knees than walking does. When you rise from a chair, your knee joint has to handle several times your body weight all at once. The kneecap has to glide smoothly, the muscles have to fire, and the joint itself needs to be well lubricated and aligned. If any one of those things is off, even slightly, pain tends to show up right at that moment. This is why so many people say their knees feel worst after sitting for a while. Sitting might feel like rest, but it can be worse. When you sit too long, joint fluid does not circulate as well, muscles become less active, and stiffness starts to build. Then, when you suddenly stand up, your knee goes from being inactive to handling a heavy load instantly. That demand triggers the pain. Another big factor that often gets overlooked is alignment. Your kneecap is supposed to move smoothly in a small groove. If it is even slightly off track, pressure gets concentrated in areas that are not designed to handle it, leading to irritation and inflammation. What makes this frustrating is that standard imaging like X-rays can look normal even when this problem is present. So people are often told everything looks fine, even though their knee hurts every day. This is why pain medication is commonly recommended. While pain meds may temporarily dull discomfort, they do not fix alignment or help weak muscles do their job. So the underlying problem stays the same. That is why the pain often keeps coming back and spreading to stairs or longer walks. There is also a conversation about body weight. This is not about judgment, it is about simple mechanics. Every extra pound of body weight increases the force that goes through the knee when you stand up. The good news is that improving how the knee moves and how it is supported can make a meaningful difference, even before weight changes. You have probably heard the phrase wear and tear. While wear does happen, that explanation is often incomplete. If pain were only about worn-out parts, it would be constant. It would not change based on how you sit or stand. Pain that shows up during specific movements is often a sign of a functional issue, not a hopeless one. When your knee hurts as you stand up, it is not saying it is broken. It is saying something is stiff, overloaded, or unsupported. It is a request for attention, not a demand for surgery. Unfortunately, many people ignore these early signals. But over time, ignoring it often leads to reduced movement, less activity, and more fear around using the knee at all. That fear can quietly change your life. You may start avoiding stairs, walking less, and saying no to activities you once enjoyed. Ironically, that reduced movement can make the problem worse. The knee is designed to move. Gentle, appropriate movement helps nourish the joint, support alignment, and keep surrounding muscles engaged. The encouraging part is that many find relief when they stop focusing only on pain and start focusing on support. Supporting the knee means improving how it moves and handles load during everyday activities like standing up. This is especially important because the pain you feel when standing up is often one of the earliest warning signs. It is the knee whispering, Addressing it early can help preserve mobility, confidence, and independence for years to come. There are gentle, practical ways to support knee comfort that do not involve pushing through pain or forcing intense workouts. Small daily habits and short routines done at home can make a noticeable difference in how your knees feel. If your knee has been sending you this signal, take it seriously, but do not panic. Pain during standing is not a verdict. It is information. And with the right approach, that information can guide you toward relief instead of fear. If you want to explore resources and gentle options to support knee comfort and mobility, you can find links in the description. Taking a few minutes now can help you stay active, confident, and independent. Thank you for watching.